When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Good evening. Welcome to Dr. Gore's show. Today we're going to talk about a very important topic, hepatitis, especially which is prevalent in Indian population that we want to talk about and get some awareness going. And to talk about this issue, we have Dr. Harish Moorjani with us. Thank you for coming to Dr. Gore's show.
Thank you for having me.
So Dr. Moorjani did his training at Maulana Azad, and then he came to New Jersey, where he underwent his training at University of Medicine and Dentistry in New Jersey, and then he went to University of New York and Rochester, where you did training in ID.
Correct. So State University of New York, Stony Brook.
Stony Brook. There you go.
Yeah.
So you've been in practice, I hear, for last 20 years.
That's correct. 1994 to now in Westchester County, New York Medical College.
Very nice. So, hepatitis, it's prevalent globally, but we're going to specify mainly for our Indian population. So, what is hepatitis?
So, hepatitis is a set of diseases caused by, majority of the disease caused by viruses. Mm-hmm. There are certain hepatotropic viruses, and there are other viruses that can also cause the infection of the liver. And then there are rarely bacteria that can lead to hepatitis, but we are not going to touch on that today.
Sure.
So amongst the viral hepatitis, there are the hepatitis viruses, mm-hmm. which is A, B, C, D, and E predominantly. And then you have the non-hepatitis viruses, which are hepatotropic, and there's a whole lot of those, CMV, EBV, herpes viruses, the whole family of herpes viruses, and so on and so forth.
That can affect the liver.
Yes.
Right. So hepatitis A, we commonly hear, like especially when you're traveling to India, there's advisory. So what's a hepatitis A?
So hepatitis A is a virus that is the most common form of hepatitis or viral infection of the liver worldwide. Predominantly seen in the third world and in Southeast Asia. So if you're traveling to India, Vietnam, Cambodia, China, South America, South Africa, Central Africa, East Africa, predominantly areas where food and waterborne illnesses are common, this virus lives in the environment, and it's transmitted from one person to another by way of either direct food contact, hand contact, fomites, towels, and so on and so forth, or by contaminated food. So we call it in the scientific terminology fecal-oral transmission.
Right.
So if you take contaminated food, or if you get in touch with contaminated fomites, and then you swallow that virus, it goes straight to the liver. It sets up a lot of damage. It's a direct cytopathic effect on the liver, so the liver cells die, and you get manifestations of hepatitis. Now in India, for example, Indians are, the common name for hepatitis A is jaundice.
Correct. And I think as we were talking, when they get this, the symptoms are usually like a gastroenteritis they are having, right? They come up with like nausea, diarrhea, and then they start developing jaundice, and that's what they remember as that this is the common cause of jaundice in India.
Right. So in children, where most of the Indians get hepatitis A, because it's so common, it's so widespread, children get a mild form of the disease. They get a little bit of nausea, a little bit of diarrhea, then they become a little yellow for a few days, and then they recover. So recovery is the norm in children. The older you get, the more likely it is that your liver will have more damage, and the body may actually result in significant liver damage, and the implications of that are pretty severe. And death rate in adults above the age of 35 is approximately 2%. So this is not a mild disease that you want to disregard. So people, when you're traveling to India, we highly recommend that you take a vaccine, which is 100% effective. I recall a friend's case for about 15 years ago. She was actually born and brought up in India, was 17 years old when she came here, migrated here, and then another 15 years later, she was going back to India to travel.
Right.
And she said, I said to her, you should test yourself for hepatitis A and take the vaccine. She says, no, I was born in India and I don't need the hepatitis A vaccine. I had jaundice when I was a child. Turns out she goes to India, she goes to Pune, and she lives with her relatives. This is, of course, 15 years ago, and came down with very severe hepatitis A, had to be hospitalized for almost 2.5 months.
Wow.
And then came back. She has fortunately recovered. But just to illustrate,
you just jumped to my next question, that was that even though we think we had it as a childhood, maybe we were born in India, maybe we had, but once we come to this country or any other country, when you've left India for some time and you were not exposed, your immunity level goes down, and you become more susceptible?
So for hepatitis A, once you have the disease, you have lifelong immunity. The level of antibody that the body forms against a clinical infection is so high that the decline in that antibody level is very slow over time, and you still have protection lifelong, almost lifelong. So, you could live for 150 years and not have a problem with hepatitis A once you have clinical disease. The problem is if you've not had clinical disease and you don't get yourself checked for that antibody, and then you go back to an endemic country and acquire hepatitis A, that's when the problem occurs. Hepatitis A vaccine is 100% protection, 2 shots over 6 months, unless you have a problem with reacting to immunizations. The vaccine
you should be immune.
Yes, so I highly recommend, if you've not received the hepatitis A vaccine, which actually in this country is routine. Every child now born in this country is immunized for hepatitis A. High-risk people who have not been immunized because the immunization policy went into effect 15 years ago are also routinely immunized by their primary care doctors. But if you have never been checked for hepatitis A and you don't know whether you've had hepatitis A and you're going to a third world country, South Africa, South America, India, Southeast Asia, it's a very simple blood test, hepatitis A antibody test. If it's positive, you're immune, you don't need anything further, lifelong immunity. If it's negative, see your doctor, get yourself the hepatitis A vaccine, 2 shots over 6 months, you're protected for life.
Right, so going back to the point, so even if you're born in India, that doesn't mean that you should be immune to it, correct? I think the best way will be to check your antibodies to get the point clear that if you had a proven hepatitis A in the past or you have proven antibodies, then you don't need vaccination.
That's right.
But if you don't know, then might as well just check the antibody before taking the vaccination. So that comes in the travel advisory too, right? If somebody's traveling to India, you would go through, as an ID physician, go through the area they are traveling and see what endemic disease are, and then you check it and give vaccination.
So hepatitis A is a universal travel immunization advisory.
Right. So it's always better to know your status, I suppose, about hepatitis A. Now, what's hepatitis B? We hear about hepatitis B. As a healthcare worker, we all get immunized, and in this country it's mandated now for the, children to get immunized against hepatitis B. But what's hepatitis B now?
So hepatitis B is another virus, another very different type of virus. It's a DNA virus that infects the liver. And the difference here between hepatitis A and B is hepatitis A is self-limited for the most part. The body makes antibodies, there is no latency of the virus is cleared by the immune system, you're cured, and if you happen to be the unfortunate person that has severe disease and has sequelae of hepatitis, that's different, but 98% of people recover and go on to be cured and live a normal life. Hepatitis B, on the other hand, is a chronic infection. So you acquire hepatitis B, and it's usually acquired through body fluids. It could be blood, it could be genital secretions, semen, vaginal fluid, saliva, any body fluid. So the virus has a propensity to attack the liver, incorporate itself into the liver genetic code, and multiply. Use that genetic code and the body's own proteins to multiply and create new viruses. These viruses not only then insert themselves into all the other liver cell genetic structure, but also release particles into the bloodstream and then into all the body fluids. So all body fluids in a hepatitis B person are infected with hepatitis B. The hepatitis B virus doesn't go anywhere else except just live in these body fluids. It cannot multiply in these, it can only multiply in the liver cell. So it's shed out of the body, and then it essentially, this whole cycle of multiplication in the liver and excretion into the bloodstream, and then infecting other people through body fluid transmission. So if you get a needle stick, for example, in the healthcare arena, or if you have unprotected sex with somebody, the exchange of genital secretions, there are receptors in the genital mucosa that can allow transmission. If, for example, you are at the site of a traffic accident and you're exposed to blood on your hands and you have a cut on your hand and the blood is infected with hepatitis B. In India, a very common form of transmission is blood transfusion.
Blood transfusion.
Because the quality control for checking for hepatitis B doesn't exist. Also, mother-to-child transmission.
Correct.
Which is a very, very big deal in India. It's estimated about 2 million babies are born every year with hepatitis B because the mother is infected, doesn't know, it's asymptomatic, and gives birth to the baby who's born with hepatitis B and now is infected for life. So there's a lot of implications about hepatitis B. It's a chronic disease. It lives forever. You die with it. It can actually kill you. It is an oncogenic virus. So once the liver is infected with hepatitis B, there is a propensity, a much higher propensity for that liver to turn into cancer. And that is one of the ways the liver can fail. So liver failure without cancer, with cirrhosis, we call it cirrhosis, or by itself, without reaching cirrhosis, the virus, hepatocellular carcinoma.
So cirrhosis is hardening of the liver tissue in general termination, and the liver is not functioning to the optimum levels and the complications. My question to you is there, do we know how long this virus outside the body fluids, like how long can they is actively infective, that material?
Okay, so once the virus is shed in the blood or genital secretions outside of the body and it's not multiplying, it can stay dormant for weeks.
Wow.
Hepatitis B, for example, can stay in dried blood for up to 4 to 5 months. And even though it's not multiplying, you know, for example,
it's still infective.
It's still infective. So if you were to, for whatever reason, get, in contact with that dried blood, you can get hepatitis B. For example, there is an insulin syringe with dried blood lying in the garbage, and you happen to somehow get stuck as a patient, you can get hepatitis B.
Right, especially on the beaches. A lot of times you go on a beach, even in New York City, if you go any beaches, there can be some needles. And that's why the question lies, how long these viruses are going to be infective, because you don't know who has used that. So I think that's an important...
Drug users, who use needles for shooting injection drug use and then discard the needle in the environment, and you happen to get a needle stick from that contaminated blood, you could easily pick up hepatitis B.
Right. Yes. So I think there are a lot of centers, who say that we won't ask questions, just come and dump your needles to prevent this kind of transmission affecting the whole general population. So going back to hepatitis B, as you just said, that it's asymptomatic, compared to hepatitis A, where you can have some symptoms. So how do we come to know? Through blood testing and...
So hepatitis B, initially when you get infected, you have a mild flu-like illness. You feel a little nauseated, little headache, maybe a little jaundice, and it goes away. And then it goes into this chronic phase, which is lifelong. And then over time, it destroys the liver. The liver then becomes scar tissue of what you call the hardening of the liver, and it stops functioning. The functioning of the liver is a detox mechanism. So it doesn't then get rid of all the toxins in your body, and your body mechanisms start to fail, and you can succumb to that. So that's how people die of cirrhosis, a hardening of the liver, because the liver is not functioning. The cure there is only a liver transplant, or it can turn into cancer. But in the asymptomatic phase, which could be anywhere from 20 to 25 years before the liver starts to fail, there are no symptoms. And the only way to check is to get a blood test. And it's a very simple blood test. Again, routine blood test for looking for the virus, looking for parts of the virus, and looking for antibody levels. So there are many scenarios, and it's a little more complicated than hepatitis A, where there are certain antibodies that can be present in certain stages without the antigen, and then there are different types of antigen that can be present in the blood in different stages depending on the patient's individual structure. So we do a whole panel of tests.
Correct. So in initial stages when there's an infection, so you have the surface antigen and surface antibody and core antibody. So depending upon the stage of infection one has, we can decide is this a chronic or a chronically active disease or a recent infection. So there are different ways that you guys play detective to tell us, like, is this something that we need to worry about? And just for our viewers in the United States, every pregnant woman undergoes hepatitis screening. That's a state mandated stuff. So we do very diligently look for every pregnant patient if they are a carrier for hepatitis, and and if they are, we send them to specialists, and the neonatologists are aware of it. So luckily in this country we have a good grasp of the situation as far as hepatitis if they follow prenatal care.
Right. So CDC actually has a risk-based screening strategy. But I recommend that every Indian get themselves tested for hepatitis B, because hepatitis B in India is much more prevalent than it is here. There is a routine immunization program for hepatitis B for all children born in this country that went into effect approximately 20 years ago. So every child born in this country is now getting a routine hepatitis B immunization. Like you said, the mother is tested, the neonatal child is tested, and if they are positive, we can do something about it. If they're negative, we can give them immunization, and the immunizations take rate of the vaccine is around 90-95% depending on the clinical situation. And so then if you have protection, every 10 years you should get your antibody level checked, because unlike hepatitis A, where the protection is lifelong, here the immunity can decline and go below the protective level. So then what we can do is very simply just boost that immunity with another hepatitis B immunization shot, and you're okay for the next 10 to 15 years. That's why you go through a series of 3 shots over 6 months, 0, 1, and 6 months. And the take rate is about 90-95%. There are certain categories of patients, immunosuppressed, people who are smokers, obese, who the response rate is not as high. And there also, you can actually do more than 3 immunizations. You can do 5, you can do double dose, you can do intradermal. There are many, many techniques to get someone protected. The other important thing is, let's say you get exposed to hepatitis B acutely. If you go see a physician within 72 hours of being exposed, you can be given what is called gamma globulin, hepatitis B gamma globulin, which will help get rid of the virus before the virus establishes itself in your liver. So you could be cured of an exposure to hepatitis B, but it requires early intervention as early as possible, within hours, minutes, but definitely within 48 to 72 hours, because beyond that, the virus has already inserted itself into the genetic code. And so it's hard to get rid of.
So we're going to take a short break, and we'll be right back.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Welcome back to Dr. Gore's show. So today we are talking about hepatitis. We've so far learned about hepatitis A, which is waterborne fecal-oral transmission, and hepatitis B, which is usually through secretions, bodily secretion, blood, saliva, etc. So we've discussed, we've diagnosed somebody now with hepatitis, and what are the treatment if they are not seen within that 72 hours when they come to you at a chronic stage? What do we do with them? So
hepatitis B in the chronic stage can be managed. Cure rates for hepatitis B, depending on the situation, are about 10 to 15% on all comers. 80-85% of the time you cannot cure it. And if you cannot cure it, you have to manage it. The good news is we have several medications now, and which are very safe, which patients can take lifelong. And it's usually 1 pill once a day, and which can result in lifelong suppression of the hepatitis B virus. Once you suppress the virus, the risk for hepatocellular carcinoma and progression to cirrhosis becomes very, very little.
So it's nice to know there's a treatment and you can kind of slow down the progression.
Yes. More importantly, I do want to mention one thing. If you are hepatitis B positive, then your partner, your significant other, your home, people who live with you at home should absolutely be immunized for hepatitis B, because the protection with hepatitis B immunization is 100%. So you won't be able to transmit it to your loved ones and to your sexual partner, to your other significant others.
Right. What about hepatitis C? You know, we talk about hepatitis C a lot in this country, in the United States. So talk about hepatitis C.
So hepatitis C, unlike hepatitis B, is a flavivirus. It's an RNA virus, which means it gets into the liver cell. It's a hepatotropic virus. So it infects the liver, it destroys the liver cell, but it doesn't incorporate itself into the hepatic genome.
Right.
So it doesn't get into the genetic code, and it has no latency. So hepatitis C is a curable disease. So we knew that 20 years ago when I went into this field of infectious diseases, hepatitis C was a killer disease.
Right.
I am very, very fortunate that in my lifetime, hepatitis C has now become a completely curable disease. Hepatitis C is acquired through blood products only.
Right.
It is not acquired through genital secretions unless there's traumatic sex. So it is not acquired through saliva. It does not live in the saliva. It only lives in blood.
Right.
And since there are no genital, it's not in the genital secretions, and there are no receptors in the genital mucosa, you don't get it sexually, unless, of course, you have traumatic sex, where there's exchange of blood.
Correct.
So it is only acquired through blood. So sharing of needles. Fortunately, we have a clean needle exchange program. So it's not an issue unless you choose to share needles. It can be acquired through snorting cocaine, because the spoon that people use to snort cocaine or the instruments they use have contaminated blood from someone else who has used it. And you can inhale it, and cocaine leads to ischemia, leads to bleeding, and can expose your blood to hepatitis C. So that's one other way. Tattoos is another way.
Piercings, tattoos.
Ear piercings, body piercings can lead to, not only with contaminated needles and instruments, but the dye that is stored in those boxes, once it's used with a contaminated needle, hepatitis C can survive there for 4 to 6 months. Wow. And so tattoos from infected needles, instruments, and from the dye itself. So one has to be very careful. The good news, it is totally curable today. 90, 95%, maybe 100% cure in a year. There are several new medications that are very safe.
Okay.
And the duration of treatment is anywhere from 3 months to 6 months. And soon it'll be less than 3 months, I think, in the next year or so. There are several medications in development.
Okay.
So again, the way to test for hepatitis C is 2 simple blood tests.
Okay.
If you have any, and in this country, there are 4 million people who are hepatitis C positive. 3 million of them don't even know that they are hepatitis C. So the current recommendations from the CDC is not only risk-based, but also if you were, most of the people who have hepatitis C were born between the years of 1945 to 1965. So the CDC recommends that anybody born during that time should be tested for hepatitis C. I recommend that everybody get themselves tested once for hepatitis C. If they're positive, go see a specialist, an infectious disease specialist, a liver specialist. They can work you up. They can get a whole battery of tests done, figure out exactly how much damage you have and what treatment is best suited for you. And the chances of cure today is 90, 95%. In a year from now, probably 100%.
So I remember going back to my medical school days, and I'm dating myself, they used to give like interferons and
yes.
Is that still in vogue, or what are the different medication? You have IV medication, how does that work?
So 10 years ago, the first treatment was an immune-based therapy called interferon.
Right.
It only worked 10% of the time. Then they improved on that interferon, and it only worked about 25, 30% of the time. So these are indirectly acting agents. These are immune modulators.
Right.
And so that's what we were using, 30, 35% cure rates. Now they have directly acting agents. So medicines that directly cause the virus to stop multiplying and allowing the immune system to cure it. That's the stage we are in currently.
Right.
6 months to a year from now, it'll be all directly acting agents that will wipe the virus out, and you'll be cured. Whether it's going to be 8 weeks or 12 weeks of treatment remains to be seen. We are still in the process of studying those drugs. These are drugs which are very, very safe, and they cause minimal side effects. So I say this to my fellows and residents when I teach. Science, time, and technology has given us tools that are safer, easier, and better. And so we are enjoying the fruits of somebody else's research.
Correct.
And curing patients for a disease that was considered a killer disease hardly 15 years ago.
Absolutely. I still remember like Hep C was like a bad news. If we had to give anybody, it was really like a bad news.
Yeah.
Now, all these medications we've talked about, and some of them are recent, some of them are not so recent, some of them are very, aggressive and curable. Are these medications covered by insurances? Because a lot of times patients do ask what's the cost of it, like cancer chemotherapy sometimes really helps, but a lot of times they have trouble getting those medications. So how does these medications work?
So in this country, at least in New York where I'm practicing, and I'm pretty sure in New Jersey, there is a big push to get hepatitis C cured. The reason is if you don't cure hepatitis C, it leads to liver failure and it leads to liver cancer. And it's estimated by the Center for Medicare and Medicaid Services that if we don't cure hepatitis C, the cost to the healthcare system over the next 10 years from hepatitis C related liver problems is going to be $850 billion. So everybody wants, all the governments, all the ACOs, all the insurance companies want this cured. There is cure, it's getting better, it's getting cheaper, there's going to be competition, and so we're going to have cheaper, better, safer medications. So I think we are going to be all cured, and I don't think insurance companies or ACOs will be allowed to deny, given the cost of these medications. But even in relative terms, the cost of curing Hep C is peanuts compared to chemotherapy and dialysis.
Absolutely. So, also, if you see the healthcare dollars, if you can cure something initially rather than spend money on chronic disease and cirrhosis and liver cancer. But I think let's hope for the best. Like in a brief few minutes, I want to talk about hepatitis E.
Yes.
So talk about hepatitis E.
So hepatitis E, another like hepatitis A, it's a hepatotropic virus. It's an enterovirus, and it is acquired through fecal-oral transmission, waterborne, foodborne, and it exists in an endemic fashion in China, in India, Southeast Asia, Africa. It causes the same kind of disease like hepatitis A, but much milder form. Okay. So even if you're an adult and you get hepatitis E, it's a mild disease you almost always recover, except if you are either old, I don't mean to offend anybody, but if you're more than 65 years of age, you're geriatric, considered geriatric age. If you're immunosuppressed for any reason, your immune system is not working, AIDS, cancer, chemotherapy, diabetes, or if you're pregnant. Right. If you're pregnant, it's a big deal because the death rate from hepatitis E in pregnancy in India has been shown to be 20% from a mild, simple infection. The good news is it's preventable if you take certain precautions. I tell patients when they're traveling to India or to China or to Southeast Asia or to South America, South Africa, you either boil it, cook it, peel it, or forget it. Don't eat any cold cuts, cold salad. Wash your hands religiously and you'll be just fine. Bottled water, those are the precautions to take. There is a vaccine, but it's only available in China and not in this country.
All right. I think in a short time we've covered a lot about hepatitis A, B, C, and E. And I think the most important thing is that boil your water and make sure you don't share needles, or at least be aware of secretions, and hopefully we can prevent this deadly disease and a very endemic disease globally. Thank you so much for your expertise and coming on Dr. Gore's show. Good night.
Thank you, Dr. Gore. Good night.
Good night.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.